Hello from Precision Assess.
Hi there.
Today, we're taking a deep dive into something, well, seems simple, but it's vital and often missed hydration, especially for older adults.
That's right.
You might think, hydration? Easy. But today we're looking at why this simple thing can actually hide a pretty profound health crisis for older folks, and how just a few, maybe surprising shifts in understanding can prevent some serious and costly complications.
Absolutely.
Just like how organizations, say the CDC, work to make health science easy for everyone to grasp,
Right.
or how places like Mayo Clinic focus on getting those right answers the first time for tricky health issues.
Yeah.
Well, our mission today is kind of like that.
To cut through the noise.
Exactly. Cut through the noise and give you genuinely practical insights.
Okay, let's unpack this.
Sounds good, because dehydration it really isn't just about feeling thirsty.
Right.
For the elderly, it's a critical issue. It can truly affect their survival and, their overall well-being day to day.
It's often overlooked. Very often.
Yeah.
But the consequences can be really serious. So we'll talk about why it's such a risk and, most importantly, what you can actually do about it.
Okay, so let's start simply then. What exactly is dehydration, and why is it such a big concern, especially, as you said, for older adults?
Well, put simply, dehydration happens when the body just doesn't have enough fluids to work the way it should.
Okay.
And while, yeah, it affects everyone, it's particularly dangerous for older people because it can sneak up so fast.
What? How so?
Well, what's fascinating here and kind of concerning is that there are a few unique reasons older adults are more at risk.
Okay.
First off, many older adults, they just don't feel thirsty as strongly as they used to.
Really?
Yeah. Their body's internal thirst signal, it often kind of fails them. It gets weaker,
Wow.
which means that classic advice, drink when you're thirsty,
Sure.
it can be dangerously inadequate for seniors. That's a really crucial point, often missed.
That's powerful to realize, how their body signals can be so different.
So does that mean caregivers shouldn't even wait for signs of thirst at all? Should they just be proactive?
Absolutely. That's the key word. Proactive. Proactive hydration is essential.
Okay, what else?
Second, some common medicines. Think about ones for blood pressure or even things like laxatives. They can actually make the body lose more fluid than usual.
Right, that makes sense.
And third, you have underlying health issues. Things like dementia, diabetes, or maybe weaker kidneys. These can make staying hydrated really tricky.
Okay.
And fourth, sometimes it's simply a mobility issue. People just can't easily get water for themselves when they need it.
Right, physically can't reach it or get up easily.
Exactly. And this combination of factors is why, in comprehensive elderly health assessments, like the ones we do at Precision Assess, monitoring fluid intake is paramount.
This was part of the assessment?
Oh, yes. And it's why expert nursing services always evaluate hydration risks, say, during placement assessments for adult family homes. It's fundamental. So knowing why they're vulnerable is one thing.
Yeah.
But what's the actual, on-the-ground impact? What does dehydration look like for an older adult, and why should every caregiver be really tuned into these symptoms?
Yeah, the practical problems can be very serious. And what's truly remarkable and often missed is that sudden confusion or agitation in an older adult. It's frequently not a new onset of dementia.
Yeah.
Often, it's simply profound dehydration. They might just seem off or more irritable than usual.
Wow. Just from not drinking enough.
Yes. Recognizing that one fact can save immense stress and, honestly, countless hospital visits.
You mentioned confusion being mistaken for dementia. Are there any, quick checks or specific types of confusion that might point more directly towards dehydration?
That's a great question. Yes, confusion from dehydration often comes on relatively quickly, maybe over a day or two, and it can fluctuate.
Fluctuate.
Yeah, they might seem more disoriented than usual, maybe even in familiar places, or have trouble focusing if you notice a sudden change like that. Especially if it's alongside other signs, like maybe their urine is darker than usual or they're not going as often. Dehydration should be the very first thing you consider.
That's a really practical tip. What else?
Another huge problem is falls.
Falls. Right. You mentioned that connection.
Dizziness or low blood pressure, often directly caused by not drinking enough, can easily lead to dangerous falls. And falls, as we know, can cause serious injuries for older adults.
Broken hips, head injuries.
Exactly. And dehydration also contributes to other health problems, things like constipation, bladder infections, UTIs.
Common issue.
Very common and often linked to poor hydration. And kidney issues, too. It puts a strain on the kidneys.
So it's a whole cascade of potential problems.
It really is. And unfortunately, all this often leads to costly and stressful hospital trips. Trips that, honestly, with proper attention to hydration, could have been completely prevented.
And for caregivers, I imagine the emotional toll, little on the financial side, of those preventable hospitalizations must be immense, has real urgency to this.
Absolutely. It adds another layer. And this is exactly why every single caregiver care plan should include watching fluid intake. It's just a foundational part of good care.
Okay, so given these really significant risks, the question naturally shifts, right? What immediate practical steps can caregivers, family members, anyone looking after an older adult, what can they actually do to turn this around and prevent these issues?
Right. Let's get into the actionable stuff.
Ah.
There are many practical strategies.
Good.
First, focus on daily monitoring and encouragement. And I don't mean forcing huge glasses of water.
Okay.
Offer small, frequent sips of fluid, maybe every 1 to 2 hours, little bits often.
Easier to manage than a big glass sometimes.
Much easier. And using simple hydration logs can be helpful too, just to keep track.
Like a little chart.
Exactly. Just
Yeah.
ticking off glasses or cups. Also, really important. Offer drinks they genuinely like.
Make it appealing.
Yes. Maybe it's diluted juice or herbal teas they enjoy. Or even just water with a slice of lemon or cucumber. Sometimes those simple swaps make a huge difference.
Yeah, I bet.
We often hear from caregivers, that just offering a favorite fruit, like melon, can be a game changer when plain water feels like a battle.
That makes sense. What about food?
Great point. Second strategy, include hydrating foods in meals. Think about things with high water content.
Like,
Soup is fantastic. Yogurt, watermelon, cucumbers, celery, oranges. Lots of fruits and vegetables.
so sneak hydration in through food too.
Precisely. And on the flip side, remind them to maybe watch out for overly salty snacks, because those can actually make dehydration worse.
Good tip.
Ugh.
Okay, what about folks with, say, cognitive impairment like dementia? That must be extra challenging.
It definitely adds a layer of challenge, but you can use simple tricks.
Like what?
Things like using bright-colored cups that are easy to see.
Visual cues.
Exactly, or reminder signs placed where they'll see them often. Gentle verbal cues throughout the day. How about a nice sip of juice now?
Keep it positive.
Keep it positive, keep it gentle, and try pairing hydration with other activities they enjoy. Maybe fun social times or snack times to make it feel less like a chore.
I can just imagine the frustration sometimes for caregivers trying to encourage drinking, especially with cognitive issues. What's maybe the single most effective trick you've seen work in those really tough situations?
That's tough to pick just one, but often it really comes down to making it a non-negotiable routine.
Routine is key.
Routine is absolutely key. Serving fluids at specific, predictable times, first thing in the morning, always with medications,
Good one.
between meals, maybe a small drink before bed. This builds a consistent habit. It becomes less about remembering to drink and more about this is just what we do now.
Takes the decision-making out of it almost.
Exactly. And you, as the caregiver, should also monitor output. Pay attention to their urine.
Okay, what are we looking for?
If it's dark yellow or amber or smells strong, that could definitely signal dehydration. A healthy person should urinate regularly and comfortably, and it should be pale yellow.
Got it. Dark urine, strong smell, red flag.
Big red flag. And lastly, always for every medications.
Back to the meds.
Yes, because some medicines, as we said, can definitely make dehydration worse. If you're unsure about any of them, ask a nurse. Or you can request a medication review, perhaps during your nursing care plan services. That's something that can be looked at professionally.
Okay.
And these strategies we've just discussed, they're really foundational to the comprehensive health evaluations and caregiver care plans that expert nursing services like Precision Assess provide.
So it's all integrated.
It should be, absolutely.
Wow, okay. That's a lot of practical advice.
So just to sum up, remember, keeping older adults hydrated. It sounds simple, but it's a powerful act of care. It has huge benefits. It can prevent those serious health issues we talked about, reduce hospital visits, and truly improve their daily life and overall well-being.
It really seems fundamental.
It is. And here's a provocative thought, maybe. Sometimes the client or your loved one might seem off or more irritable, maybe confused. Yeah. And it's not necessarily some complex new condition starting. It could just be dehydration.
It's just dehydration.
It's worth checking first. And that's why good care, effective care, truly starts with precision, with paying attention to these details.
Precision. I like that.
And that commitment, to clear, actionable expert insights, that's exactly what we aim for at Precision Assess.
That's such an important takeaway. And honestly, potentially transformative for so many caregivers listening. That idea that off behavior might just be thirst.
It's a game changer sometimes.
So if you need help with things like nurse delegation services or perhaps a placement assessment for an adult family home, or you need support in building a really solid hydration-focused care plan for your loved one, reach out to Precision Assess.
We're here to help.
We really hope this deep dive helps you feel more informed and maybe more confident in providing the very best care.
Thanks for tuning in.